call the meeting to order.
Yeah, I'll do the roll call.
Okay.
City Attorney Kuzam is excused. Mayor Kearns is excused. Commissioner Mazzola.
Present.
Okay. Chair Harville.
Present.
Member Skinner.
Present.
Kaplansky is excused.
Present.
Maturo.
Here.
And excused.
Hey, Charlie, just to be clear, Brian is on. Mark is not.
Okay.
Yeah, Brian is here.
Let me step back. Kaplan.
Present.
Thank you.
This might make the meeting difficult, but with the ambient background noise, if you're not speaking, if you could mute your mic and then just remember, if you're like me, I forget half the time when I'm talking to unmute myself. So if we could just do that, there's, it could be just all the connections and things tonight going on. So I think we have to approve the previous minutes to start, and looking through everything, like usual, I didn't see any conflicts or interest or any issues with those. If anybody else has anything to put in.
No, I move to approve.
I'll second.
Was that Skinner?
Yes.
Yes, sir.
Harville. Okay, thank you. All those in favor to approve, say aye.
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 Thank you.
All right, Joe, we will start off and let you speak on COVID.
Okay, well, good evening, members of the board. Good to see all of you. Appreciate you having me back with you this evening. Let me just start, I guess, with the governor's announcement this afternoon, which was very exciting. The state of Ohio has designated Franklin County now a level 2 or an orange designation in terms of the public health advisory system. So we obviously we're thrilled about that. Franklin County had been level 3 or that red level since the inception of this advisory system. We clearly are thrilled about that. And one of the reasons that we've been able to move from a level 3 to level 2 is because the incidence of cases has been dropping in Franklin County for about 4 to 5 weeks. We've had a nice steady decline in cases in our health jurisdiction. Again, this is outside of the city of Columbus and city of Worthington, but in our health jurisdiction, we've been averaging between 40 and 50 new cases per day, which comparatively speaking, when we go back to early August or late July, it was between 80 and 100 per day. So we're very thankful for that. And certainly from our standpoint, we've been, I think our community has done a remarkable job adhering to our guidance and the state masking order, as well as the county's masking order. And so, there's some good news here, and I think that's something we need to celebrate. If you happen to follow Franklin County Public Health on social media, which I hope that you all do, but if you do, you're going to see a fun little graphic that we put together over this afternoon to really kind of not just sort of celebrate the move from a level 3 to level 2, but really to remind our residents that we have a path to choose here moving forward. That it's not just about getting to orange, that it's to continue to make progress. Certainly, in no way would we say that this virus is under control, clearly, but we do want to acknowledge, the fact that we are making progress and that we have a choice to make in terms of our path forward. Do we want to go back to red, or do we want to continue and make progress and work towards yellow? And of course, we're going to continue to challenge ourselves to do everything we can to get to yellow, knowing that that'll be, of course, given the complexities and the size of Franklin County, that may be difficult, but that's obviously what we're going to continue to do. So a good day for our community, and we're going to continue to try to build on that progress. At the health department, we continue to hire a significant number of contact tracers They're formally called public health investigators, but they're doing contact tracing for us. And so actually our Board of Health just met at 6 o'clock this evening, giving us authority to hire additional contact tracing leads, where we now have built out multiple teams of contact tracers, utilizing funds from the state of Ohio, which are actually federal dollars from CDC. So our staff continues to grow, and which really puts us obviously in a better position to continue to do timely case investigation and contact tracing. So we will continue to hire through the course of August and likely hire through the rest of the year, quite honestly. So we have that many number of cases where we need to continue to hire. So right now we are between 20 and 30 public health investigators. We're also leveraging public health investigators from the state of Ohio who are employed by the Ohio Department of Health. They have a team there that they've made available to us to do additional contact tracing. And then we also have a contract with the Healthcare Collaborative of Greater Columbus to employ community health workers in that same capacity. So we continue to really expand that capacity at the health department, and right now able to obviously keep up with the number of cases that we continue to see on a daily basis. From a communication standpoint, I mentioned social media. We continue to post new information not only on social media but on our website. And I don't know if I can share my screen or not, but if I can, I'll see if this works. Maybe just to kind of make sure that the board can navigate our COVID-19 website. Can you all see this? Yes. Okay, great. So this is our COVID-19 website. We're of course going to be updating the level 3 designation here, but really just has a whole host of resources and information. Under resources, you'll find information regarding businesses, for residents who maybe need assistance, financial and otherwise, that they can access, information for our schools and childcare settings, and then information about masking and how to protect yourself and others. We also have shareable items and infographics here that you can take and utilize, whether it's for your own use on social media or otherwise, or for your employers and other organizations. So you can just click here and you can download those kinds of infographics and shareable resources there. We're building out our testing page here. A lot of conversation around testing right now. We just employed a consultant to help us look for more community-based partnership opportunities to expand testing in Franklin County. And so that individual will be working with our healthcare partners and community-based organizations like faith groups and other organizations to look for ways that we can do more community-based testing. That person will also be serving as our point of contact to the National Guard to look at opportunities to bring the National Guard back to Franklin County, to do the pop-up clinic testing in underserved communities as well. So all of that, it will be sort of placed on this part of our website here. And then we also, on our website, have information about our weekly conference calls, which we're hosting again at 10 o'clock on Thursday mornings for all of our partners. This is an opportunity for us to give a 1-hour update about COVID-19, what the health department's doing, and then feature a community partner as well. This morning, we were pleased to welcome Dr. Amy Fairchild, the Dean of the College of Public Health at Ohio State, to give some remarks about how the college and the university have prepared for back to school and return to campus, and some of the updates that they have been able to make there as well. And on this website, you'll see notes from each of our calls here. So they usually get posted about a day or two after the call. So tomorrow or over the weekend, you'll see today's notes or notes from today's call will be posted here. But you can always reference those at whatever convenience for you, so that you can have that latest information. And then I just also want to point out to the board health here this evening on our homepage here on this website. You can access our daily EPI report. This is a high level here, but you can access our daily EPI report here. And just want to point out 2 new features that this report now has. If you haven't looked at it recently, you'll see a sort of a 14-day trend line here for our new cases. So you can take a look at that. And this is for our entire health jurisdiction. This is, again, outside of the city of Columbus and the city of Worthington. And at the bottom, you'll see case counts for our health jurisdiction that are within these zip codes here. So, and we have a sort of a linear way of looking at it as well. So you'll see some of the zip codes that have a higher incidence than others. So those are kind of new features of our EPI report on our website. And of course, I can make the link available to all of you as well. So, so that's a kind of a brief update of where we are. Before I go into any other detail, maybe I'll just pause and try to answer any questions that members of the board may have.
Yeah, I've been on the website a few times, and the information, the graphics are well done. You guys have done a good job keeping updated. And so I don't forget, I know your time, Joe, is probably not enough hours in the day to do everything you do. So thanks for giving us the minutes that you have tonight to give us the information. I tried to fill in your shoes last week or last month by getting the information off, and I heard many snickers why I was getting my report. So you do a very good job, and I appreciate it.
You're welcome. Happy to be here.
I actually do have a question. What so we know Ohio State's in session now, and I saw their 43210 zip code looked like it wasn't one of the worst. But what is the expectation as we move into fall and we hit cold and flu season come October? Or is that kind of a unknown crystal ball to look into, or what's the expectation there?
Well, that's a great question. And so I think, there's, I think, general concern from public health about how flu season is going to transpire. We will start with our flu surveillance beginning in October 1st. We'll start collecting data regarding flu. But I think, there's kind of in my view, there's sort of 2 points of thought here. One is certainly if we take a traditional flu season and you put the pandemic on top of that, could obviously make for a very difficult fall and winter from a public health standpoint. The other way to look at it would be the fact that we, of course, now are doing all the things that relative to COVID-19 that are certainly applicable to influenza. So we talk about masking and social distancing, paying extra attention about staying home when we're sick, additional attention on good hygiene, hand washing, etc. That obviously would potentially put us in a better place for flu as well. Now, I do want to also mention that we are going to be making a substantial push regarding getting your flu shot. So we typically, and I may have mentioned this at the meeting last month, but we typically would do, certainly we would do some natural partnerships with our healthcare partners and local communities to promote getting your flu shot at a typical flu season. This year, we're going to make substantial investments to really bring that awareness higher. So we've already started having conversations with some partners and organizations looking for ways that we can really elevate this because of the importance and the relationship here in terms of making sure that we're staying healthy in the context of the pandemic. So that would be something I would love to be kind of take your feedback on how we can elevate that conversation in Grandview Heights, certainly. But we're going to pay particular attention to looking for opportunities to address influenza more proactively than we ever have before because of where we are with the pandemic. So that's some of the initial thoughts that we have, and probably have some things in place in September because we don't want obviously to get too far into flu season before kind of raising that awareness. So we're going to be making some investments here pretty soon along those lines.
And then what?
I wonder if I could just respond to one thing there or ask one question, which is, I wonder about partnering with the schools on this, especially with the delayed entry into school and so much on the line and so many people really wanting this to stick. It seems like a time where people would take that more seriously. So I don't know if that's something, Joe, that you've been thinking about elsewhere, but maybe we could talk about that.
Yeah, so schools will be there'll be a key audience for us when we talk about influenza and elevating that conversation about getting your flu shots. The other part to this is we are going to be working with the Ohio chapter of the American Academy of Pediatrics to raise awareness around vaccinations, overall vaccinations. October 1st is the reporting deadline for schools for back to school vaccinations. The Ohio chapter of AAP, with some funding from the state, has put together a toolkit and some resources that they put together. So really, overall, vaccinations are going to be kind of our next kind of emphasis as we get into the fall. And so more important now, more than ever, is that we don't want our kids to get behind on their vaccinations. Clearly, individuals have probably delayed that just for some hesitancy to get back into their healthcare provider for obvious reasons. And so trying to have that message collaboratively with our hospitals, with our community health centers, with our school districts, to make sure that we're sending that message to our community that families should get back to their pediatricians, their primary care docs, make sure their vaccination status is up to date, and then, of course, make sure that they get their flu shot as well.
And what would be the main outcome that you're looking for as far as getting the flu shot? What are you're talking about just hoping to reduce comorbidities, not get the flu on top of having COVID or having those two at the same time? But what's the main purpose that the messaging you're putting behind getting the flu shot um, this season?
Well, I think it's all the above. I think certainly from a morbidity and mortality standpoint, on any other given year, flu season and influenza takes a significant toll on our community. Now, flu is not a reportable disease for adults, but it is for under 18 as far as flu deaths. And so, we want to make sure that we take every opportunity to ask our residents to go and get their flu shot. Just from the morbidity and mortality of influenza. When you combine that with the fact that it has consistent symptoms with COVID, it creates certainly from a healthcare and provider standpoint some complications. Our providers are going to have to deal with figuring out if an individual obviously has flu or COVID, and they're working through those protocols right now. We're on conference calls twice a week with the chief medical officers for the 4 hospital systems here in Franklin County and Central Ohio. And that's one of the things that they're working on now is preparing for that and how they're going to handle that from a healthcare standpoint. But really, in my opinion, in any given year, I don't think influenza gets enough attention. And we have to continue to improve our vaccine or our vaccine uptake with flu, just from a general morbidity and mortality standpoint of what flu can do to our community and does to our nation every year. So obviously we're hoping that it's a good match this year. We'll have some initial data probably, it's usually late December. We'll get some initial data from CDC on the efficacy of it. But again, this is many other year. We really do need to do as good a job as we can to make sure that folks are taking that step to get that vaccination as a preventative measure.
Yeah, so you're looking at just reducing obviously overall deaths and then also trying to reduce the load on the healthcare system with those additional individuals being
Yes.
in the healthcare settings, facilities,
That's
PCP
exactly
offices,
right.
all that stuff. Okay.
Yeah.
Can I just add one thing or ask? It's really kind of a question. I'm thinking about myself here, right? I get my flu shot typically at work, and I have no intention of going into the office for the rest of the year. So I wonder how many people are in that situation. And if that's a good cause for a role for the city to play, because so many more people are working from home, where they might be missing a flu shot opportunity.
I think that's a great point. Obviously, many of us do get their flu shots while they're at work, in whatever setting that is. I was just on a webinar for our healthcare wellness provider, and that was one of the questions that came up. Was many of county employees are working from home and won't have the same opportunity to get their flu shot as they would otherwise. So they're going to have to make other arrangements. So that's going to have to go into our thought process of how we message that. And one of the audiences that I didn't talk about originally was our employers. we have to engage our employers or who maybe if they would typically would host a flu clinic within their setting if they're a large enough employer. If not, obviously reminding them as a benefit to make sure they're reminding their employees to go and get their flu shot wherever that might be, whether it's at a pharmacy, their primary care doc, wherever that might be. So I think it's going to be a tricky message for sure. It kind of goes back to the previous idea that generally we have as a state and I think as a country we've fallen behind on our vaccination schedules for our youth. So and that really is just hesitancy to go back into the healthcare setting. And so I know our healthcare partners are really stressing that it is safe to go back and get your vaccinations. And make sure that our residents hear that from their healthcare provider, that it is a safe environment for them to be in, to be seen, to get their primary care visits done, to get their vaccinations done, and any other wellness visits as well.
Joe, this is Joelle. I have a question about something that I heard. I'm not 100% sure that I heard it accurately. I think it might have been the Hilliard City School District that was talking about the possibility of looking at more localized data on infection rate rather than using the statewide metric of the red, yellow, orange system. Can you comment about how you track those numbers more locally and whether that is a good or a bad idea?
Yes, so you're talking about a partnership that the Hilliard City Schools has with the Ohio State University College of Public Health, and we are a partner in that project. Just from an advisory standpoint, we've been working with them as they put that together. So they're doing some pretty sophisticated analysis of some varying data sets. I believe absenteeism data will be included in that once they do go back into the classroom, and some other more granular data regarding case counts for their particular school district. So they're definitely putting together a project that will be very informative for their school district. The good news there is that they have already talked about how maybe we can scale that up across Franklin County. So that's why we want to be a partner in that conversation. So we have been, we have various meetings with them about that project. I don't have any more specific detail to provide the board here this evening, but it's certainly a very innovative project, and I think will be something that we'll be able to learn from and hopefully apply across our entire health jurisdiction as that kind of moves forward. And so I'm happy to follow up with the board with some additional details. That would be something you'd like to learn more about.
Thank you very much.
And maybe just one more comment regarding schools. So continue to stay in very close contact with all of our school districts, both our public schools and our private schools. Just had a few emails with the Grandview Heights superintendent today. So, very regular communication with all of our K through 12 partners. We have a conference call every Tuesday morning with all the public schools, and then a conference call with all the private schools Tuesday afternoon. So regular communication with all of them as they kind of consider making any kind of additional changes to their back to school plans here moving forward. So.
Anyone? Go ahead, Amita.
I saw some other cities, and I don't believe in Ohio, had opened up, I guess, closed down streets and let restaurants spill over onto options. Is that something that's being considered in, I guess, Columbus?
I'm sorry, you broke up a little bit there. I didn't quite hear the whole question.
Hey, Joe, it's when your microphone is on that the sound goes back and forth. So if you can stay muted, it helps, I think. Sorry to be the bearer of bad news.
Thanks. A couple other cities I had seen outside Ohio, I believe, had closed down some major streets and let restaurants spill over to allow for more outdoor dining options. Is that something that's being considered in Columbus area? Because I thought it'd be something nice for Grandview, actually.
Yes, there are some cities that are doing that, and we are providing that approval and technical assistance for them to do that. Off the top of my head, I forget the name of that distinction or that program, but I do know that several cities have done that, and we're working very closely with them to make sure that that is done in a proper and safe way. I will make a note of that and send that over to the board. I would assume that we're sort of running out of good weather, but if there's still an opportunity to do that in Grandview Heights, I'd be happy to work with the city in whatever capacity might be helpful.
Amita, did you have something in mind in particular? I'm curious now.
Some of the restaurants are closing, and just to garner more business, and people are going to restaurants. So we had gone to a small town in Michigan, and they closed down their streets, and there was like a lot of tables spaced 6 feet apart outdoors. And I just thought it was nice. Like, we got an ice cream, and it's the first time we had eaten out that I felt safe to do so. So I just thought it was a nice thing they had implemented. They did a really nice job. They had signs everywhere: wear your mask, be kind. But they also were allowing people, I think, to get out and enjoy some of the things in their community.
Yeah, I was just wondering more where that would actually be in Grandview. I was trying to visualize it and wondering if you had a more specific, thought, but we can talk about that.
Yeah, I think it's a great idea and a great suggestion, a great point. I think maybe it's something we could throw up to the mayor's office to see if there's a weekend in September or even early October. Those weekends tend to be very nice and dry, and would be conducive, I think, to eating out and doing something like that. I think it's a great idea, Amita.
We'd actually talked about that 2 or 3 months ago, and the mayor was concerned about the fact that our roads are not set up for instance, closing off Grandview Avenue. And so we had talked about that that if we close Grandview for the restaurants, there'd be traffic on the smaller roads, parallel. So she was concerned about that, earlier this spring, but I think it's a great idea too.
Yeah, I do remember that, Brian. I remember her being concerned, and I think if we look into doing something just, I guess it'd be a Saturday or something, but closing just, in the early afternoon hours to the evening, I think Grandview Avenue could tolerate that, and I think the city could with, doing something. But I think it's something to be brought up again. I think it's something to put on the agenda and with the city council and see where we could land on it.
Emily Keeler. I love the idea. I'm just not sure Grandview Avenue would be the space, because unfortunately a lot of the restaurants that would need outdoor seating are no longer open. So I guess I would just want to know how that would work and what businesses you would picture there. I love the outdoor seating. I do. I don't know if we have the businesses in that area to fulfill that request.
I would guess north of 3rd is technically Columbus, isn't it? It would not be Grandview.
Yeah, the restaurants that we have on Grandview Avenue, Faggio closed, a couple other restaurants closed. One is already a patio outdoor seating anyways, and so most of the restaurants that are still open are in the Columbus side.
Yeah, maybe it's something we can do and talk to City of Columbus and just closing that block from 3rd to 5th. I still think it's something to put on the agenda, and it might take a little bit of doing, but I think, I know the Woodlands and some other people own restaurants, and I know they're still suffering considerably with the social distancing and the only a certain percent of occupancy. So I would still be in favor of pushing to get some information, figuring out how we can make it possible. I think the businesses, whether it's opening up the parking lot, possibly even, and have it a walking night and try to make it a community event or something. I still think it's something to consider and something to see if we can't make work.
The other issue is, do we want to encourage large gatherings, out in the streets? So that's the other problem.
Well, I think that'd be the whole point of having it outside and having the number of spaces available and having people make reservations and things with those restaurants. I'm sure they would be conducive to doing that for the business. Because I know, again, I know the owners of Trattoria, and so I think the businesses, if we had a night to spotlight anything up through there, the businesses, and try to limit the number of people there, I think they would be more than happy to try to help us do that.
Well, I'll just say, as far as street closures, the normal process is it's considered a right of way, and so the owner of that property, being the city, whichever city, Columbus in the instance that Mitch just mentioned, would have to give authorization, and then secondarily, if there's liquor being served, there's another layer of complexity associated with that, because of Ohio's fairly weird liquor laws. And I don't pretend to know a lot about the liquor laws, but different permit categories have different permissions associated with them as far as where you can serve alcohol. So I would say, just very generically, that between the owners of different businesses north of 3rd Avenue and the city of Columbus, that's something that they can work out collaboratively. But again, there are some weird wrinkles that, in theory, sound very pleasant, and but in execution can involve some hurdles.
Okay, thanks.
Yeah, the last thing I would want is, if we had enough time to come up with something that was going to endure over some weeks or months, that'd be one thing. But I'm a little worried about one-off events. I do think they become clusters, and a super spreader is the last thing we're talking about here. So, I support the idea, but I would be curious if there are sort of middle ways we could think about things that would have some more time to develop. And also, it takes time for these kinds of establishments to even learn how to do it, right? There's a kind of curve of setting up and getting going. So I worry about that from a public health perspective, but also I wonder how much buy-in there would be, actually, given the possible risks.
Okay.
And if I could, I just put a link in the chat box to the revised code that gives cities authority to do this. And I know many of our local municipalities have looked at this, and Hilliard being one, I believe Powell and Burlington, and maybe a few others. But we would, at the health department, we would certainly work with the city to craft it and then certainly implement it if you wanted to move forward with it. So.
Anything else about COVID or the current topic that anybody wants to discuss at this point? All right. I think the next item, Joe, you're back up. Just any of the administrative updates and other typical items we would cover on your monthly reports. Joe, I can't hear you. Can you on mic?
Yeah.
You're still showing up as muted on my screen there, Joe.
Okay, can you hear me now? I'm sorry. You can't go through a day without having that happen to you, right? The whole mute unmute thing. So, so my apologies to the board. We weren't able to send this to you in advance, but hopefully you can see here our environmental health report for Grandview Heights. In all candidness, I've not read the whole report yet, so we're going to read it together here as we kind of go through. So let's start here under community environmental health. We did have 2 dog bites, one on July 23rd, one on August 6th. One was released, and then the other one, the animal location was unknown, victim was notified. So no further follow-ups there, but there were 2 dog bites in Grandview Heights over the last several weeks. Pool inspections. 4 pools were inspected over the course of the last month. And looks like, again, just reading this with you here this evening. So looks like nothing out of the ordinary in terms of our pool inspections. And, we didn't have all of our pools open this year. So this has been, for us, we have been working really hard to make sure that if there was an operator that did want to open up, that we were being responsive to any kind of timely pool inspections. And it appears we had 4 of those conducted within Grandview Heights. Vector control. Of course, this is we're in the middle of mosquito season. So it looks like for those mosquitoes that we trapped within that particular trap within Grandview Heights, none were tested positive for West Nile virus, which of course is a very good thing. And thus we likely did not do any spraying as a result. Food safety, you can see the number of inspections that were conducted, 15 standard inspections, no need for any additional follow-ups, no complaints, and no consultations provided either. So fairly standard inspections there for your food safety, or excuse me, your food service operators. Plumbing and medical gas, we did 39 residential inspections, 15 commercial inspections. Again, nothing out of the ordinary there. And then nothing from our sustainability section. Just for the board's benefit, our sustainability section is looking at things like climate change, looking at sustainability around recycling, and also with lead investigations and inspections as well. So that is our report from environmental health. Again, my apologies for sort of walking through that with you kind of in real time. Happy to answer any questions that the board may have.
Joe, I do have a question for you. So I was looking at the map around mosquitoes the other day. There was some spraying scheduled kind of on the west side, I believe, of the area. Nothing to the south in the Scioto there. I know that you say that there's been nothing in the traps with West Nile, but the mosquitoes have been horrendous. So I wonder if you could explain kind of how that works.
Yep. So, yes. So a couple thoughts there. So first, as a county, we actually have had a number of our traps actually yield mosquitoes that are testing positive for West Nile virus. So we are doing a considerable amount of spraying in and around Franklin County. It just so happens that the Grandview Heights trap has not yielded that West Nile virus positive in your community. You bring up a great point though about the incidence and the number of mosquitoes. So a couple of things there. One, I would say it's always a good opportunity to remind residents and businesses about standing water. And so making sure that we're getting those messages out. We've been doing more around that with respect to social media lately, and any help and assistance that you can help us with that, getting that message out. Please let us know how we can partner in that regard. But then also we can always do spraying or within the community at the community's request. Based on again the incidence of the amount of mosquitoes that we're seeing within the traps. So we can do that for special events at the community level, and we can certainly have a conversation specifically about what we're seeing in Grandview Heights and design sort of a response that would be appropriate given what we're seeing as far as the number of mosquitoes that we're trapping. So that's always an option. We do have a pretty robust capability there because of our mosquito contracts. So let us know if the city would like for us to explore those more proactive opportunities. Of course, anytime we do have a trap that that has mosquitoes that test positive for West Nile, we always reach out to that municipality and schedule that scheduling. Again, only with the authorization of that particular community. So we never would do any spraying without the authorization of that community. But in this case, if you feel like because of the incidents, because of the nuisance, if you will, we always have that opportunity to look at more proactive approaches.
Thanks for that, Joe. I do think, especially with COVID, outdoor time is just so valuable, and I'm hearing it from people over in Marble Cliff. I'm hearing it from all around our community that a lot of people functionally can't be outside. So I guess I'm still a little unclear on how this committee works, how this board works in these moments. But I would like to suggest that we do encourage the city to consider asking for that. I would also like to ask the city to take the commissioner's advice and talk about standing water and see what we can do as a board to promote thinking about that. I don't know if anybody else has ideas that they want to maybe throw in there.
Another question, Joe, to continue with Dan's comments. The 282 in the trap, where does that fall as far as average numbers for the season in Grandview?
I wouldn't. I think I'm on mute. Oh, I couldn't answer that question. I wouldn't be able to, not off the top of my head, but I'm happy to go back and research, previous years' data to look to see how we're trending this year.
If my recollection that the 282, and Dan, on this is nothing to you. I agree with you. The mosquitoes do seem bad in Grandview this year, not just because we're out more. But the 282 does not stand out to me as being an increased number from what I remember past years. But my wife and I have both been outside, laughing at our legs like we're losing our minds on multiple nights, and we have been out a lot more too. And I don't know which comes first, the chicken or the egg. But I would agree with Dan that maybe an additional spray would be necessary. When do the mosquitoes typically kind of start to naturally die out? Is that as the temperature cools as we get into September, like early mid-September?
A little bit later than that. I would say early October. Really not until we get that first good freeze overnight. So we'll see mosquitoes into October for sure.
Okay.
But I can certainly, again, at the direction of the board, and with, I know we have members of the city administration on as well. We're happy to convene a conversation kind of as a follow-up. So if you just let me know how best to do that, we will make our staff available to have that conversation at the city's convenience.
Yeah, I would agree with Dan. I think that's a follow-up where we would appreciate it.
Yeah, I don't know what we need to do formally as a board to make that happen, but whatever it is, I'm trying to start it. So,
I think you've done. I think what they'll follow up, and
okay. Thanks.
In one fell swoop, you've completed all actions, Dan. Any other updates from you, Joe?
Let me just back to the. Yep. So the only other thing I would mention, again, we have probably still about 2/3 of our staff are working on our COVID-19 response. We're transitioning as we were able to bring on temporary staff that I talked about. We're able to transition our permanent staff back to their typical programs, and so that transition will continue. I do want to mention that next month we will be starting the second year of a 3-year grant that we received from the Centers for Disease Control and Prevention regarding overdoses and opiate addiction. So this is it was a $3.9 million, now a $3.5 million grant that allows us to do a whole host of different strategies in cooperation with the Columbus and Franklin County Addiction Plan. But we will be kicking off year 2 later in September and really focused on creating enhanced surveillance and monitoring across Franklin County implementing prevention curriculum within schools across Franklin County, looking at advanced treatment options, as well as additional supports for the community. So that's a significant grant for us, and we're already 1 year in and looking and excited about year 2. It's also going to include a $500,000 anti-stigma campaign addressing stigma and the idea around addiction, and how those who are facing challenges with addiction are also faced with the challenges of stigma from friends and the community. So we're going to be doing a fairly significant marketing effort around that as well. So look for more in the coming weeks, but that'll certainly begin before this board meets again in late September. So I wanted to bring that to your attention. And I think that's it for now. Happy to answer any questions that you may have regarding any other programs or services.
When
I was just going to say, speaking of addiction, Tesla had done a great job early in the year looking into vaping, and we haven't talked about that in about a half a year now. And I did see that, and who knows if this deadline had any meaning at the time, but in May, the vaping companies had a chance to go before the government and petition their cause. Do we know where we stand with vaping laws?
Well, I'm not familiar with any new legislation right now. Could be that there's some pending legislation, but I'm not, off the top of my head, I'm not familiar with any. I do know that the Franklin County Tobacco Free Collaborative is still meeting regularly. They had their last meeting yesterday. And so we received another grant from the state of Ohio to continue to do education, particularly in the area of vaping. So we'll be looking for opportunities to work with whether it's schools or other organizations to continue that awareness. I know that obviously with the state moving from 18 to 21 last year, that was certainly a significant policy change. And I do know that there has been discussion at the municipal level across the state of Ohio to look at banning certain flavors of vaping products. I don't foresee anything happening at the state level, but I do know that there's certainly some local communities that are looking at some policy options in that regard. So that might be something, again, for this board and others to consider. And of course, always happy to try to be a part of those conversations.
Yeah, I think that's an excellent point as far as banning. I know that was, I don't know, Brian, if you were talking about that. I know that was one of the things that came out, was that probably a year and a half ago, when the deaths were in the news that they were going to ban like the bubblegum flavors, the grape, and some of that stuff, which, I think is a good idea. And I didn't know if that was a national ban that was being looked at. At the time, I think it was discussed. I don't think anything ever was done with it. And if it has been, I think COVID's probably taken over any highlight in the news that would have brought to light. But I definitely think that's something to put on the agenda for a future meeting. Again, I think there's only one location in Grandview that can sell that stuff, which is, or there may be, I think there's only one, I think. Charlie, do you remember? I know there's the one spot that drive through Northwest first, but I didn't know if that was the only location in Grandview that sell old products. Maybe he's not still on. Okay. Anything else from you, Joe? Any other comments, or does anybody else have anything with previous topics that we've discussed tonight?
Just like one last question for Joe. Do you know the percentage for the contact tracers? What percentage of presumably infected people are able to be contacted? Do you know how often, how successful your tracers are in actually getting to the people they want to get to?
Yeah, so we've set a goal for 3 days so 72 hours. We don't always meet that depending on the day. So in other words, if we get a day that we get a higher number of cases reported, certainly that's much more difficult to, because we have to start with the case investigation and then identify the contacts. It kind of ebbs and flows, and that's one of the reasons why we continue to hire, is to make sure that we're staying current with that. I can tell you that anecdotally, that our staff, our contact tracers are telling us that individuals are becoming a little less reluctant to share information. So as we talk to the case, to the individual who is COVID positive, we are experiencing residents who are reluctant to share who those contacts are. And so we actually are going to be looking at, and we're working with a national group to put together some messaging for our community to really remind them about why it's so important that when the health department does call them, that they take the time to have that conversation with us, and really help us do our job, and that is obviously to isolate and quarantine. And that's not anything particular to Franklin County. We're seeing that across the country. We're seeing sort of this just sort of fatigue about COVID and individuals just not being as willing to share information with us. But generally, that's the time frames for us, is around 72 hours. Logistically, that's always a challenge, whether it's trying to get a hold of somebody, over the phone, or other ways. But it's something we're going to remain focused on. It's something that obviously, from a contact tracing standpoint, it's not just that internal capacity; it's keeping those messages, current or not current, but keeping those messages with our community about how that's such an important part of our strategy to really try to get to keep up with this virus, not even get ahead of it, but really to keep up with it. Any way that we can continue to keep those messages in front of our residents about why it's so important, contact tracing is such a vital part of what we do. So I hope that helps answer your question.
Yeah.
Joe, this is Charlie Beauchamp. I have a question. Typically in September, I think we review the contract. Are we going to have that available for the board to look at before the September meeting?
Yes, thank you for bringing that up. So our Board of Health will meet on September 15th to consider the contract amounts for our 14 cities. And you should be receiving a draft contract late September. So we have our Board of Health meeting actually is very late in September, again, not to the 15th. We pushed it back a week because of the Labor Day holiday. But we will do our best to provide a draft to Grandview, certainly ahead of the Board of Health meeting. But our time frame is right around the end of September.
Thank you.
You're welcome.
Hey, Joe, I just wanted to ask one follow-up on the contact tracing thing. Maybe this is a fiction of my brain, but isn't there, I know you don't want to always go to legal fast, but isn't there a legal obligation to cooperate? And is that part of the work as well?
Well, there really isn't a legal obligation to, it's not as if it's a terrible analogy, but it's not as if they have to raise their hand and kind of say, I'm going to, give you the whole truth and all that. There's a legal obligation for us to isolate. We absolutely have those legal authorities to ensure that someone is remaining in their home during their isolation period. And we've actually been very fortunate there. Folks have really done everything we've asked them to do as far as keeping that isolation order, following that. But as far as offering information, we really have no legal way to compel them to provide anything more than what they're willing to tell us.
Okay, thanks.
Right.
Right, Dan, I know you had some items that you wanted to talk about.
Nope, we already did them.
That's what I thought. I just wanted to make sure we covered everything that you wanted. Um, Additionally, Charlie, we had a comment earlier from Dan, and if members want items added to the agenda, is the proper channel to contact Megan to get that done?
Yes, you can contact Megan, you can email her, and if we put those on there, we can do that.
Okay, right. Yeah, I think Dan tried to do that and I was not successful in getting a response. So we'll make sure. I just wanted to make sure that that was the proper avenue to take um, to get that done. Um, and then I know, Emily, are you still on the call?
Yep, I'm still here.
Okay. Was there some items you wanted to talk about or a subject you wanted to discuss tonight?
I will just let you all know we have some ceremonial resolutions coming up at our first meeting in September. One will be a resolution recognizing National Suicide Prevention Month. One will be recognizing childhood cancer awareness. Those are both topics that have hit our community in the past year, and we will have local representatives who will receive those, not at the meeting, but later on due to social distancing. But we'll be posting resources online for the suicide prevention. So if there's any resources that you would like to see included in that list, you're more than welcome to email myself or Greta or Bob with any suggestions you might have. But I think we're excited to bring awareness to those topics. And, it always means a lot more when it hits home. And so we just want to recognize those.
So are they going to, is the board or the city council looking at declaring, I know September, those, I think those two items have a month as, are we just looking to make something more legal or some type of recognition in the city charter or what are you talking about there?
It's a ceremonial resolution that will declare the month of recognition for the city of Grandview Heights.
And what months are those?
Those are both going to be at our first meeting in September.
So September will be the month that will be declared for both of those items?
Correct.
Okay. Okay. Anything else from city council that you'd like to pass along?
No, just thank you for everything that y'all are doing. We appreciate all your work, and it's exciting to be able to join in and hear you guys in action. So thank you for letting me join in tonight.
Yeah, well, thanks for being on. Anyone have any questions while Emily's on regarding city council or any items as they regard or as they connect to the Board of Health?
I said I didn't have anything else, but there was one thing, and I don't know if this is a question for Emily, but it is a thing that occurred to me during the water issues that we had recently. I went on to make sure that I was signed up for all the text alerts and all that stuff, and I realized there is a Board of Health emergency text system. So I guess I'm a little curious what that is and how we would use it and what that would entail, since it's a specific thing that comes from this body. That's how it's billed anyway on the Grandview Heights website. So does anybody have any information about that, and is that something we might be thinking about?
So I think Bob could probably speak more to that. I know we've updated our list recently and have made more use of the messaging systems, all of the messaging systems, but that's really handled by administration. So Bob, if you have anything to add to that.
And just to clarify, there's
I'll-
there's an emergency system, but there's a specific Board of Health one as well. So I was kind of curious that's what I'm trying to tease out is when would we use the Board of Health system as opposed to like the general emergency, alert system.
Yeah, I would have to check on that for you. I'm happy to get with Bob and Aubrey and Greta and report back on what that might be. Make sure someone follows up with that.
That'd be awesome. Thanks.
Yeah, I think having the members of the Board of Health added to any emergency alerts would probably be something that would be conducive to spreading the information through the city.
So the system is opt-in, self opt-in. So anyone
Okay.
can go on and sign up for what you want to sign up for, and you can state your preferences at any time. So if you just heights.gov and go to the sign up for alert system, it should be one of the buttons at the top of the website, and you can just go in there and opt for either emails or text messages or both.
Okay, great, thanks.
Just to add to that, I mean, Grandview did a really good job with the water issue compared to, especially the city of Columbus came in for a little bit of criticism there. I was seeing, but the other issue is that if it's opt-in and if it's a Board of Health specific text alert, email alert system, then we need to promote it. Then people, I mean, I'm guessing most people don't know it exists. And right now, people are focused on health issues with COVID, with the water thing we just went through. It's a great time to do education. So I would like to see us find a way to promote that. I don't know how that would be, but maybe through some kind of city materials that are already going out or something of that nature.
Sure.
This is Joelle. The only printed material that goes out to everybody.
Continuing to inform people.
What's that? I'm sorry, I missed something that Emily said. I apologize. The only item that goes out to everybody is the Parks and Rec brochure. So we'll think about how to include some information in there about the opt-in. And it is a challenge for the city. I mean, we can't really have an opt-out because we don't have people's addresses. I'm sorry, email addresses and telephone numbers. We only have street addresses as taxpayers. So it has to be opt-in, but we will definitely give some thought to some ways to increase the traction there.
Any other items?
I'm sorry, the board may want to set the next meeting.
Yeah, I was just saying before we did that, I just see if there's anything else that anybody wanted to bring up or discuss. Being nothing else, so the next meeting, we've typically been meeting every month. I didn't know with the contract coming in from Franklin County late in September, if we would want to skip September and possibly meet in October to look at that contract. And then as long as we submit it to city council before the end of the year, that meets our requirements. Does anybody have any comment or concerns about meeting in October versus September?
This is Emily. If it's a resolution, that's fine. If it's any kind of ordinance, we would need to have 3 readings. So just keep that in mind. We don't always have a mid-month meeting.
No, this is the contract that we would submit from Grandview or from Franklin County to the city council. This is a contract.
Right. If there's any councilmatic action that you need, a resolution can be passed on the first hearing. But if it's any kind of ordinance, it would need 3 hearings. So that in mind.
Yeah, typically the contract does get 3 reviews, 3 readings, because it involves an expenditure of city funds. So for all intents and purposes, if you review it in the month of October, and you can schedule your meeting anytime in October, and if you need to have a follow-up meeting, you can. But if you do an initial review, send a recommendation to council at some point in October, council is likely to have a mid-month in October, and then for sure a first meeting at the beginning of November, and possibly a mid-month meeting in the middle of November. So just, I think I'm just trying to say, keep in mind, the timing, so that we don't count on having to have a mid-December meeting at a time of the year when people are hoping not to have more meetings.
Okay, so
May I interject?
Sure.
Typically, we do it in the end of September because that allows for, the timing of it. If you do
Right.
it in October, it'll be towards the end of October. I think it's October.
Yeah, that's fine. Let's just do it for September then, and I think that'll satisfy everyone. So that's good with me.
That's probably a better choice.
Yep, I'm good with that. All right, so if we look at September,
24th.
the 24th would be the fourth Thursday, 7 o'clock. Any comments, concerns with September 24th at this point? You sure, Dan? You're quiet. Okay, there we go. All right.
It's my eyes. I was trying to look at my calendar. That's all.
So we will set the next meeting for September 24th, and then hopefully we will have the contract from Franklin County at that point. If we do not have it, Charlie, what, because Joe said they wouldn't meet until middle of the month because of the holiday. If for some reason we don't have it at that meeting, would it be reasonable? I know we typically meet the fourth Thursday, but could we meet on another day through the month because they're virtual and approve that to get it to city council in case there's some issues with all the business Franklin County is dealing with right now?
We have to coordinate with the other kind of virtual meetings that are happening. Typically we do fall on the 4th. There are other virtual meetings. I don't know. We'd have to double check that, but typically Commissioner Mazzola gets that to us pretty quickly, and then we'll turn it over to you guys. So I think we'll be okay.
All right.
Let's see how they get it to us.
Okay. All right. So next meeting date will be September 24th. And I think some follow-ups, I think for our next meeting, to maybe look into the banning any of the vaping flavors to see kind of where that is, and some type of communication about the opt-in city alerts and communications for the flu shots. Any other items that we would want to add for next month? So I'll get those to Megan, and Joe's going to follow up with the mosquitoes with the city. So I think that's all the kind of the notes I have right now. Anybody else have anything they'd want to discuss next meeting?
Not yet.
Okay. If you do, you can contact me and I will push those to Megan, or I know we all have her email with the correspondence that she sent. But feel free to send her anything, and we'll get it next meeting, get it going. Being no further items on the agenda, I move to end the meeting.
Okay, thank you.
All right, thanks. Thanks, everybody. Appreciate it.
Thanks.